So people keep asking me questions about my bypass surgery, so let's get into it. My gastric bypass was on, I think, November 14th, 2022, and it's been about 2 months since the surgery. I am down 50 pounds from my pre-surgical weight, which I checked about a week before, and then they checked, of course, you know, at the hospital, but I checked about a week before and I'm 50 pounds since then. So a lot of people have been asking me, is it worth it? Would you go back and do it again? Yes, I would, because I feel better than I did. Obviously, I can breathe so much better. I have asthma, and I was having to take my inhaler 3 to 4 times every single day. I couldn't go through my house without getting winded. It was really difficult, and my autoimmune diseases did not help with all of that. So, you know how that goes if you have chronic illness. I do have things that I have to go and get infusions for. I have tons of medication that I take, and my health was just at a weird, not great place. My metabolism, they said because of all of my diseases and things that it basically didn't do its job and probably didn't really work at all very much, I guess. So, because I've always struggled with my weight, and yeah, finally losing, which is insane, and I'm so thankful for it. So I've been taking my multivitamins and my calcium citrate. You really just have to go with what your nutritionist says, but I have to take, I think, 2 of the vitamins a day. I haven't been consistent because I'm very forgetful and I need to make lists. Lists help me so much. Or like calendars, like I carry around a date pad. I just don't look at it every day, which I should. But everything's been good as far as the weight loss goes. I've been very, very nauseous, and I can't eat very many types of food yet without getting sick. So I really just have to be careful. I can't hold very much, you know, just like I don't even know, like maybe like that much, like 2-3 ounces. I don't know. It's not a lot, and sometimes I'm full after like 5 bites or 10 bites. Just like, and by bite, I mean like really tiny, very minuscule. You have to really keep in mind that your stomach can't hold a lot at this point, like right after surgery. The surgery part went well. When I woke up from anesthesia, I remember waking up in so much pain, and then so they gave me pain medication because I told them, you know, they asked me, how are you? And I was like, I'm hurting really bad. And I was in and out for hours after surgery. I was, anesthesia hits me kind of hard, so I was in and out, but it was overall a good experience. I was up walking, you know, the next, I think, morning, like early, maybe even it was that night, but I was up walking just very slowly, and I have 6 little tiny scars about that big, because they did it laparoscopically, which I'm thankful for because I didn't want a really huge scar, and also that probably would have took a lot longer to heal. I don't know. My scars are healed though. They healed after a few weeks, and my immune system doesn't work as well as other people's because I'm on infusions that make it not work as good as other people's because of my autoimmune diseases. So this may go quicker for other patients. Just keep that in mind. Everybody's experience is very different. But I'm really proud of myself for sticking to my pre-surgical diet and my diet afterwards. Like, it was really hard. Really, really hard. I kept wanting to give up. I kept wanting to quit, and then I thought, you know what, 6 months from now your life can be completely different or it can be the same. And so I stuck with it. I just made myself stick with it and told myself, this is going to be worth it. This is going to be worth it. Next year you want your life to be completely different. You want to be able to do things with your kids that you can't do right now. You want to be able to get around. you know, because my autoimmune diseases make it hard enough for me to get around and do things that are just regular, normal things. So that has been overall a good journey. I would say 10 out of 10. As far as experience goes, I didn't expect to already be this far down in 2 months, but I'm thankful that I am. I think that some people lose slower than others. So if you are going through this journey with me, or right before me, or right after me, just keep with it. Don't give up on yourself. Make sure you say your affirmations and be good to yourself. You know, you're worthy no matter what size you are. And, you know, I had to know that. And because sometimes I would like really hate looking in the mirror and being sick and not being able to do anything about it as far as exercising. Didn't change my weight. I was a cheerleader for 11 years, always the thickest girl on the team, always. And that always messed with my mind and my brain, and I thought, you know, what's wrong with me? But now I realize, and all of these new health problems have come about. So they said that the autoimmune diseases that I have are genetic, and that there's nothing I could have done to, you know, prevent at least the one, and the stuff that just runs in my family, because there are a couple of them that definitely do. We have a lot of weird health history in my family, so I got some beautiful genes from my grandma and my mom, but as far as health goes, you know, but it's fine. I have tried to take it a step at a time, because when I first got diagnosed with rheumatoid arthritis disease, I was devastated, like so devastated, because number one, it's chronic, never goes away, so that was really disheartening. Number two, I was to the point before I saw a rheumatologist and went on medication, I was to the point where my spouse was having to help me get dressed. I couldn't pull up my pants, and I couldn't hardly get out of bed. And I definitely couldn't get up off the ground if I got down to play with my kids or something. I couldn't actually do that on my own. I couldn't get out of the bathtub. I couldn't brush my hair. I got such a bad knot in the back of my head that it was almost like a dreadlock. And I was so embarrassed about it, and I didn't tell anybody. I just cut it out. And so I have, like, in the back of my head, if I can find it, hairs that are just so much shorter. I can't find it. They were so much shorter than all of the other hairs in my head, because I cut it like almost this close to the root, and now it's probably like that long. So, but if you're going through something like that, don't be embarrassed. It's not your fault. I was just in a bad place, and they have put me on 7 or 8 different medications since I got diagnosed early 2021. Wow, I guess it's been almost 2 years now. But either way, I started medication in April and quickly started to see some changes in my body. The first through the 6th or 7th medication has not put me into remission, which is what my doctor wants. So now I'm on infusions at the Cancer Treatment Center, and hopefully those are gonna do their job. I don't know. I'm hoping so. I think I've got faith. Got my fingers crossed, got faith. I think that's gonna be good. Yeah. But also, with the gastric bypass, if you don't have support or a support group or somebody to talk to about it, I would recommend it, because it's hard for people to understand unless they've been through things, but also if you have someone else who's gone through the same thing as you, like me, like you're watching my video right now, you're gonna be able to relate to that person, and that person's gonna understand what you're going through, maybe some of the decisions or some of the reasons that you decided to do the surgery, because a lot of people are gonna discourage you. They're gonna say, you don't need to do that, you can do it on your own. Well, some people literally have so many health issues that they can't, or they, whatever issues that they have, mental health, I don't know. But some people just, their thyroid doesn't work, or their metabolism, whatever it is. You can do it, but sometimes you need a little bit of a tool, and this is a tool that has helped me a lot. So I would definitely say do your research. I would definitely say talk to your doctor. I would definitely say research people who have also done it, which is what you're doing, but always do that. And have faith in yourself. Don't give up on yourself. Don't give up on the journey. And I'm proud of you.